In our Wisconsin Watch tonight, a new report found that the amount of mental health staff and services in the state is not increasing in proportion to the mental health needs of kids.
Katrina Lim has details on the report's key findings.
The mental health needs in children were substantial prior to the pandemic, and those needs have only grown, especially for those most isolated and vulnerable.
According to the 2021 annual report of the Wisconsin Office of Children's Mental Health, 29% of Wisconsin high school students felt sad or hopeless. It also showed there was an increase in adolescents experiencing a major depressive episode. Those numbers were recorded pre-pandemic, but state mental health experts say the need for resources for these kids has only grown.
What was happening with children before the pandemic has just been exacerbated by the disruptions that families have experienced during the pandemic.
And while the report shows the number of health professionals such as psychiatrists, school social workers, school counselors, and school psychologists has increased, experts say we still need more.
We do not have sufficient numbers of mental health professionals to address the entire demand.
Child and adolescent psychiatrist Dr. Allison Jones with Marshallwood Clinic Health System in Eau Claire says this increased need for youth mental health treatment is also seen locally.
There are many more new patient referrals being sent over on a daily basis from primary care physicians within the community.
According to the study, the key to improving children's mental health and well-being is social connectedness.
Especially with, increased amounts of virtual learning, less activities and other social boundaries, there has been an even greater decline in social connectedness in our youth. And that's super important as they move into high school and adulthood.
Health professionals say parents should be involved in the day-to-day emotional well-being of their children. And if you're truly concerned, talk with your child or even ask their friends or teacher if they've noticed anything different.
All right, that was Katrina Lim reporting. The Office of Children's Mental Health also launched several resources in 2021 to help kids navigate their own mental wellness.
That includes a feelings thermometer, a mental health crisis card, and a mental health services guide.